In this recording, I'm going to be doing an introduction to healthcare quality management. So in this presentation, I'll start out by talking about quality and what quality means for us in a consumer world. And it does talk about value. So value is important not only in a consumer world, but also in a healthcare kind of concept. Then we'll talk about quality and how that can be differentiating, again, primarily using a consumer world as an example. Then why is healthcare different? And we'll talk about healthcare quality and look at some of the factors of those in terms of that differentiation, which are these particular factors, and I'll talk about those individually. And then I'll look at the definition of quality according to the Institute of Medicine. And they discuss 6 key quality dimensions in healthcare, which I will review. So, when we talk about quality in a consumer world, and we start out here, at least I do, because we can all relate to that fairly simply because we are consumers. So, what we want to do is meet the customer needs and expectations. First of all, we need to know what those expectations are, but then we need to, meet those particular needs. The quality is dynamic, and it can be something of quality today may not be quality in the future. And this is uh, a photo of an old Cadillac. Now, Cadillac was considered what was one of the first U.S. made vehicles, one of the first vehicles made in the world, and it was considered to be a luxury car. Now we have others, right? We have Lexuses, Mercedes, things like that. And so its kind of quality image has changed. And sometimes quality can be improved, again, using example of a vehicle here. This is Hyundai, right? So I always talk about my Hyundai story and my I Hate Hyundai blog because when I was a graduate student, a poor graduate student, I bought one of the first Hyundais, which was an Excel, and it was bad. It was just poor quality, and at 70, 80,000 miles, it just died. It wouldn't go at all, right? So um, I had this really bad perception of Hyundai as being poor quality. And apparently a lot of other people did too. And that's when they were the first to really come along with the 100,000-mile warranty or guarantee warranty, I suppose. And that really changed the perception of it. Now, Hyundai is one of the more popular foreign brands in the US, and their quality has improved substantially. They had to promote that with the warranty because of the perception of it being really bad. And when we purchase something, we always have risk associated with it. So that was to avoid or alleviate some of that perception of risk. Now, we talk about any type of quality, it really is about the value. And value is kind of a misnomer. People don't really understand the word value because they think about value as being inexpensive. But that's not true. Value really is a combination of quality, service, and price. And that's what we call this triad. It's really called the customer value triad. I didn't come up with it. Someone else did, someone smarter than me. But the center of that is our value or our value proposition. And that value proposition is a set of benefits that satisfy the needs of our particular stakeholders. Now, value is really at the core of everything we should do for consumers and in healthcare. And healthcare, we're just satisfying different stakeholders, as I'll talk about. But value really is the ratio of benefits to costs as viewed from the eyes of the beholder, who in a consumer kind of world is the customer. In a healthcare kind of world, it could be the community, it could be clinicians. But really, we want our benefits to be weighted towards us and have costs being, you know, more minimal in terms of that balance. And that's really what value is. So when we think about customer benefit versus the cost, there just aren't there's more to it than we really think. So the benefit could be the product benefit or service benefit. So a lot of times, even if you're dealing with a pure product, there are services involved in it, right? You could be looking at your laptop. I'm working off a laptop, but there could be services um, connected with it if something happens with it. I had to send it in and it had to be sent to the shop wherever Dell's shop is last year. And I was hoping for a new one, but then there are also personal benefits. Well, how does a particular product, like a vehicle, maybe fit into your personal lifestyle and what you think you are? Do you need one even? If you live in an urban area, maybe you don't need one. And what's the image benefit? What's the image you get from buying a BMW versus a Hyundai? There's nothing wrong with either of them. One's more expensive than the other, but you get an image benefit. Now, so those things are pretty straightforward, but the total customer cost are different because usually we think of the first thing up here, which is monetary cost. Well, there are other things. There are time costs and energy costs. So the time cost is something convenient. One thing that Amazon has going for it is that there is little time cost. I mean, you have to wait. So if you want something fairly quickly, there is that time cost. What's the energy cost too? And it's not just energy going from one place to another and in really looking at energy terms, but energy you spend in searching for alternatives or searching for the best solution to a particular issue. And then there are, of course, psychological costs. Psychological costs are ones that not only do you have internally, like if you purchased a Hyundai like I did and then it dies, like, oh man, I made a big mistake, right? So, and that has psychological ramifications even to today, and that was 20 years ago. But there are also psychological costs in terms of how the image is portrayed to others, right? So, it's like, oh wow, do I look smart in making that particular decision, or not? So, right. So those are psychological costs. So what we want to do in terms of our um, particular decision making is to weigh those particular elements and really have all the costs, all the ones, be less than the benefits. We always want to receive more benefits than costs. So perceived value is something, right? You have perceived value is the difference between the prospective customer's evaluation of all those benefits and all the costs. And so we have a lot of different types of perceived value, right? So there's one type of perceived value in going to a high-end um, shopping mall. I don't remember the last time I was in a shopping mall, or getting your guinea pig. Hopefully, you don't get a guinea pig in Amazon. But there are different types of alternatives, and the perceived value here is ease and convenience. I just like this image. Not that they really sell guinea pigs or ship guinea pigs. And here it's different, right? It's maybe about image of shopping, being out. It's more maybe of a social thing. So those are the perceived pieces of the value. And so we have a lot of different types of differentiating factors that we think about in perceived value, like form. So that's just the size and kind of the weight of a particular piece of product or equipment. And I use mobile phones here as a good example. Just got a new mobile phone and I like really small ones, right? Well, that's not really stylistic these days. Or it could be the features. What does it do? Right? Or performance quality. The performance quality is like, this is the best rated car according to US News and World Report for 2020. Or we talk about conformance quality, and I put Coke here. So conformance means from time to time, and this is a difficult one for services in general, but for healthcare too. And really, conformance means that from time to time, your the way you perform is going to be the same. Now we know that's going to be difficult in a service environment. You think of some services, simple services like Starbucks or something like that. They have a formula that they follow for each drink, and that should be the same. But it's not always the same because you have people as part of the equation in there. So they're really, they could come to work. Well, they have to start early probably because coffee's usually um, consumed in the morning, but and they might be tired, right? So their performance might be a little bit different. I put Coke here because products like that they're easy to measure the conformance because first of all, their recipe is standardized and usually they're mechanized. And so you can also take batch samples. So you can take batch samples and see how chemically this particular batch should conform to the overall standards. So that's what conformance is. We also have durability and reliability, which are connected. So durability is you know, how something is lasts, and reliability is from time to time, like in a car, when you get into it, does it start? Or, when time to time when you try to, log into, I don't know, your VPN, does it work? So that's reliability. Repairability is pretty simple, and I have an example of an HP device here because they're pretty repairable. Where something like Apple is not repairable. It's done that way specifically so that you have to go in, right, and they have to sell you a new one. But repairability is something that can be a differentiating factor. Style, of course, is a huge differentiating factor, especially in consumer-driven products. And this is, I'm going to butcher this name. I know it's Christian Louboutin, something like that. How is that for French? But what's patented in these particular shoes is the soles, which you see are red. And that's a specific style element. They get hundreds, thousands of dollars for that just because of the style. So we know that healthcare is different, and it's different for these particular factors. The industry in and of itself, healthcare organizations are different from corporate organizations, although they are companies in kind of a systematic way when you think about how they're organized according to government standards. And then healthcare products are different than other products. Healthcare professionals are different, and healthcare consumers are as well. So I'll go through these individually, starting off with characteristics of the industry. So typically, we assume buyers and sellers are driven by an economic motive, right? Um, to maximize their benefits. I mentioned that in that um, graphic where I described the balance between what costs we're getting versus the benefits. And so usually companies are wanting to maximize their benefits, right? Organizations do. And we do as consumers as well. And typically we assume there are many buyers and sellers that that kind of mitigates the whole cost and price issue. But we don't necessarily have that in the area in which I live, and many of the students do too. We have two huge players in healthcare, UPMC and Allegheny Health Network. And so that's really not really a competitive environment in terms of pure economics. So the characteristics of the industry, most businesses are profit driven. So the characteristics of the industry are next. And that's really the bottom line. But most healthcare organizations are obligated to accept clients, whether or not they can pay for their services. So a lot of times too, buyers pay out of pocket. We expect to pay out of pocket. That's what we do. But in healthcare, we always have third party payer systems, health insurance and health insurers who are part of that particular industry and economy, which means that it's not a lot of it is not paid out of pocket. And so the general rules of supply and demand don't apply. An increase in supply doesn't mean a decrease in price. So just because we have more surgeons available to do transplant surgery doesn't mean that there's going to be a decrease in the price of transplant surgery. An increase in demand doesn't drive up prices. It doesn't mean that, if we had issues with, COVID recently, that, prices are going to increase for people for um, ventilators or something like that. And most decisions affecting demand are driven by gatekeepers. That's the fact of the industry. And the gatekeepers can be insurance companies. They try to hold down on costs. And we can also think about, physicians like our PCP as a gatekeeper, especially if you're dealing with, an HMO or managed care kind of situation where they're trying to manage that care and give care to people and the least expensive part of our care continuum, then they are going to be gatekeepers in this particular situation. Also, healthcare organizations are next in terms of how healthcare is different. And they are multiple purpose organizations with a lot of different goals going on simultaneously. There are goals from administration, there are goals from the clinician side. So many of these organizations, one piece of fact, obviously, is that they are nonprofit organizations. So they're not driven by profit. Of course, some are. So some organizations like insurers, like Anthem and others, are driven by profit, which means, they're trying to organize within an industry that is mostly driven on the service side by nonprofits. So that makes things really convoluted, and it also makes things a little bit different in terms of goals that each organization has. Also, we're dependent a lot of times on government subsidies. Medicare is the number one, Medicare and Medicaid. If you think about the Centers for Medicare and Medicaid Services, they're the number one largest provider of health insurance in terms of enrollees. And so that means some organizations are wary of that because we know that they reimburse at lower rates than private insurers, but it comforts others perhaps in the market, especially people who are dealing with, for-profit organizations, thinking, oh, well, they get a lot of their money from Medicare, Medicaid. That's stable revenue that they know exists, so it might comfort others. Next is the types of products in healthcare are different. So marketing services is very different than marketing products. And a lot of what we have in healthcare are services. We have products too, but here's a continuum of mostly goods to mostly services. And goods products are easy to evaluate, and we call them high in search qualities. You can search for it. You can go from store to store if you still want to do that, and you can actually touch that product. And those are search qualities. Services, and we have medical diagnosis all the way over here, are what we call high in credence qualities, meaning that they have to be credible. And that credibility is usually about the institution. It's usually about that person delivering that service one-on-one with and their office with that particular patient. We also have issues that healthcare products are prescribed, right? So we have that, and there's a whole kind of continuum of issues that go with that, from the prescription and clinical trials to getting it approved through the FDA, all the way down to how is a particular physician going to prescribe that, why would they prescribe one thing over another, etc. We also have consumers pushing and saying, we want this prescription. And then obviously too, in healthcare, a lot of services aren't substitutable. And I put this image up here because, I consider, and I might be an outlier in this particular thing, but for me, Coke and Pepsi, if I wanted something like that, are pretty substitutable. I I don't know that I would pass a taste test. I say that I prefer Pepsi and over Coke, and I don't drink them a lot, but I was required to say that because this is healthcare, and but I consider them to be fairly substitutable. So the next thing are healthcare professionals, and so healthcare professionals, really, the institution is driven by um, um, clinical professionals, and has been, and not administrators. And they may not share the same goal, right? So a lot of times, administrators are driven by bottom line issues of the organization, where clinicians are driven by, or should be, by health outcomes. Also, we have medical ethics driving a lot of the behavior in the profession, and should. And that means that there are also independent systems of operations that FDA overview and oversight. It's highly regulated industry, which we know a lot of product types of industries may not be. Even if we look at things like the supplement industry within healthcare, it's not really regulated as much, obviously, as prescription drugs or healthcare services because the FDA is just not involved in those. And a lot of times, too, within an organization, there's anti-business orientation of many health professionals. And that can be from the clinician side, since it was driven by clinicians, and they're supposed to say, it's all about the patient outcome. How can we drive revenue if it's really based on what the patient needs? And we don't, that the patient needs are not driven by uh, that type of demand. It's kind of whatever they're dealing with in terms of their health and their health care. Next thing is the consumer. So everyone is a health consumer, but healthcare organizations haven't seen people as consumers. So hospitals don't see it as the same as going to a grocery store. Um, and healthcare consumers are insulated from prices, as I mentioned, because of third-party players. And so their healthcare consumers aren't likely to really limit their resource utilization. They're not going to pay for something that's, if you were a consumer and it's like someone comes up with a big price tag, so I'm not paying for that. But if someone else is going to pay for that, like an insurer, then that might switch your kind of perspective on that. So that in pure economic sense is not really a market, right? Is not a typical kind of market. Providers don't have incentive to provide efficiencies, which means taking costs out as well. And there's really not um, a means of competition, as I mentioned. Healthcare consumers do have, as I mentioned with this law, privacy concerns. And of course, HIPAA is a big issue and a driver. We have privacy concerns in other institutions too, in other industries like financial services. And actually, financial services are much better in terms of providing that security. Um, and they're highly regulated as well, right? So they have Federal Reserve and other institutions looking over them, just similar to healthcare. And of course, there's an emotional component to healthcare that we may not even have with financial services. So let's talk about the concept of quality, which can vary by stakeholder. And the stakeholder groups, are different, as I just kind of went through, in healthcare than they are in a general consumer world. And that can be payers, right? So we have purchasers and payers, and they view things as trying to be cost effective. And then we have those providers. Those providers could be hospitals or they could be individual clinicians. And those clinicians, it gets even more convoluted because clinicians could work for a hospital or they could be working in a private practice, running their own business, which has this whole other layer of complexity to it. And there's also legal liability, right? So legal liability from those clinicians' standpoint. Overall, we do have reputation. So this is just an article from a Wharton blog about Mayo Clinic as being having a top reputation. So in terms of that, we still have reputation as a pretty significant factor, and that factor really leads people to a perception of as a healthcare consumer of what they're going to consume. So we think about going back to the definition of quality. This is the definition of quality according to the Institute of Medicine. And the Institute of Medicine, IOM, will use some key publications of theirs in this course. They are now called the National Academy of Medicine. But they say quality of care is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. And they talk about it in terms of six key quality dimensions. And they say these six key quality dimensions are going to be significant in terms of one, it's safe. So that's care that's intended to help patients and should not harm them. It's also effective, and that's care that should be based on scientific knowledge and provided to patients who could benefit. Care should then, on the opposite side, not be provided to patients unlikely to benefit from it. In other words, underuse or overuse should be avoided. And it should be patient centered. Care should be respectful of and responsive to individual patient preferences, needs, and values. And the patient values should guide all clinical decision making. It should be timely. So care should be provided promptly when the patient needs it. And it should be efficient. So waste, including waste of equipment, supplies, ideas or even energy in terms of physicians or clinicians should be avoided. And we know we're not hitting all of these, right? That's the idea of this class. We're trying to improve quality within a system. And now, lastly, the sixth thing is that it should be equitable. And that's the best possible care should be provided to everyone. And that everyone means regardless of age, gender, race, financial status, or any other kind of demographic variables that exist within the population. So that concludes this introduction to healthcare quality management. Of course, I have three other recordings and videos that follow in this week, but this just kind of gives you an introduction to what we mean by quality in the healthcare system.